Welcome to the Littleton Board of Health Wednesday, April 21st Zoom meeting. We are going to have a COVID update today. And if you have any questions, please raise your hand, state your name. When you're called on, please state your name and address. So I'm not sure if, so I guess, Jim, we're going to start with you. Katrina's not here this week. So if you can give us as much information as possible.
I'm holding the show tonight, huh?
You are you're headlining.
I was hoping for Katrina. She adds so much more. All right, so what I'll do is I'll start with the numbers as usual. And I guess the good thing on the numbers is both the 2-week rolling and the weekly numbers trending down, which is nice to see. So, the last three numbers, the last three rolling weeks, you had 32 3 weeks ago, 28 2 weeks ago, 18 this past 2-week rolling, as reported today. No, last week. So the numbers are trending down. The weekly numbers, we had got up and, near the end of March, we're up around 22, 21 cases. The last week we're about 13, and it's about 8 cases so far for the week. So again, hopefully the numbers are trending down. District-wide, the numbers are trending down again. We're not seeing 30s and 40s anymore. It's more teens and low 20s per day, which is a good sign for us. Mike asked me to take a look at the vaccination numbers for the town. The state prints a great chart that has all of the towns in the state and has it broken down by many different things. So what I do is I pulled apart of the chart for you, and this is population, number of cases either with 1 dose or 2 by age range. And this is as of March 13th. That's the latest date that's up on the website. So 0 to 19, there was 152 people in town who have gotten their first dose. They don't report any of those having gotten their second doses yet. And again, there could be some 16, 17, 18, and 19-year-olds that have gotten vaccinated because of the types of vaccine out there. When we were doing the first responder clinics, we were seeing, some of the on-call personnel who are younger. And so some of those may be in that category. I just don't know. Sometimes when the number is so small, the state puts an asterisk in the chart for some reason. And for second doses for that age group, there's just an asterisk there. So there was no number for fully vaccinated. For the 20 to 29-year-olds, 434 persons received a first, 215 received a second. So the 215 of that group are fully vaccinated of the 20 to 29. 30 to 49, 1,241 have received a first, 600 have received a second, so they're 600 are fully vaccinated. 50 to 64, 1,647 received a first, 731 a second, so they're fully vaccinated. The 65 to 74, 903 received a first, 681 a second. So that's how many of those are fully vaccinated. The 75 plus, 578 individuals in that group have received a first, 449 a second. So of those age groups, the 34 to 40, let's see, make sure I get these numbers. 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. Okay. The 20 to 29-year-olds, 24% of that group is fully vaccinated. The 30 to 49, 27%. The 50 to 64, 29%, 65 to 74, 68%, and the 75 plus, 57% fully vaccinated. So that's kind of the rundown of the numbers of vaccinations. It's interesting that the over 75 has got a slightly less percentage of fully vaccinated. I'm not sure if that's getting to a clinic or access in general. So I'm not sure of that number. The number of active cases in the state, which again is one of those numbers you look at as it has been dropping. So before this current bump up, it had been in like the mid 20,000s. And it got up to, I think it was creeping up towards almost 40 again, but now it's down to about 32,000 active cases, and that's as of today. I've talked to both camps in town about their operations this summer. I've sat down with Littleton Parks and Rec to go over questions that they had about their programs and how they plan to operate this summer. I've had conversations with Camp Neshoba about how they plan to operate and some questions that they had. The state put out guidance specific to camps this year. Last year was kind of grouped in with all of the childcare entities, so daycares and preschools and all of that. This year here, the state put together information that kind of stands alone for camps. It is it doesn't have anything new essentially. So pretty much what they needed to do last year is what they need to do this year, unless of course you're a residential camp, because the residential camps weren't allowed to be open last year. They are this year. I don't believe there's any residential camps in Littleton, so it doesn't really affect anybody in town. But those requirements are a little more onerous in that you have to test 3 days before you come to camp, test the day of coming to camp, then you're allowed to stay in certain cohorts, and it is a lot of scheduling and that. So I understand what they're trying to do, but boy, it's a lot of work if you want to be a residential camp this year. So, and that's one thing that may cause some confusion. I wanted to bring it up because we were on a seminar with the Department of Public Health today about just general topics in public health, and camps and Christian's law were the big topics today. And there seemed to be, I don't want to say some confusions or just some concern about the requirements that the Department of Early and Secondary Education has now for contact tracing in schools, in classrooms in schools, and on buses. And I say that very specifically because DESE updated their guidance for schools, and now close contacts are anyone within 3 feet if you're in a classroom and both parties are masks, or if you're on the bus. So it doesn't apply to any extracurricular activities or any school clubs or sports or anything like that. It only applies very specifically to kids in a classroom, both masked, all masked, and on the bus. That was in the Department of Public Health. They had an epidemiologist on the call, made a point to say that the definition of close contact has not changed, but for the purposes of DESE and for the K through 12, they had changed that for the schools and the bus transportation. So if you hear kind of why is there a difference, the epi alluded to some studies that indicated that seemed to be safe to be able to just do the close contacts at 3 feet in those situations. Not a whole lot of, and we don't have this. I don't have the studies to provide you, but that the Department of Early and Secondary Education was a decision that they made in connection with the state's command center. So again, that's a little bit of a disconnect. So if you hear, not a disconnect, but a difference, and it was a significant enough difference that the people attending that seminar, probably mostly health agents, were really looking and striving for clarification. And the clarification for us was it only applies in classrooms and on buses for K through 12. So that is the, and that was revised as, that guidance from DESE was revised as of, what's today, the 21st, as of yesterday. And I guess the other thing I would speak anecdotally about it is, I know in the weeks after school went back into full sessions, we were seeing a lot of close contact, a lot of close contacts generated because of a person testing positive. Now you've got all these people in the classroom. So I know our public health nurses had been working with school nurses throughout the district to get those contact lists to the state so that they could actually reach out and do the close contact. So I don't know if that's generated some of it. I just don't know. And we'll see what happens after vacation. Fortunately, Easter didn't seem to be too bad, number bump wise. Hopefully school vacation is kind of a similar situation. It doesn't turn out too badly. I don't know if there's any questions.
Jim, those numbers that you for vaccination, is that just Littleton?
That's just Littleton, yep. Mm-hmm. And they have it broken down. They have it broken down by gender, by race. Mm-hmm. So I mean, it's it's a chart with a lot of information, but I figured I'd grab the age ones because, as of this week now, everybody's eligible. So hopefully you'll start to see a difference in those numbers now that people everybody can go and get a vaccination. And hopefully tomorrow we'll find out about Johnson & Johnson. Not tomorrow, Friday, find out about Johnson & Johnson. So.
All right. Does anybody have, so I think Camp T did really well last year, correct?
They did. I mean, of the camps, I think we probably had, I don't know, maybe 8 camps open total throughout the district. And they did an extremely good job at keeping the kids masked. And they always run a very orderly program. I mean, the kids seem to have a good time, but they seem to be in full control of what's happening there. That extra element of making sure the kids had their masks on, they really did a great job with. So really have no hesitation with them operating as a camp. They just do a really nice job. And Camp Neshoba has had a history of great compliance. So again, I have no real concerns with Camp Neshoba operating.
Don't they have one night, like Thursday night, that they have a sleepover at Camp Neshoba?
That I don't know. When I talked to the camp directors, again, the requirement for testing is for overnight camps, and it's been my experience that they just have day camp programs, and so she had mentioned that she thought maybe they needed to do the testing, and I said unless you're doing an overnight component, and she said they weren't. So.
All right. Does it? There was, and I might be jumping ahead. I saw on the news this morning that Newton Public Schools are requiring pool testing for extracurricular activities. I don't know, maybe I'm jumping the gun and maybe it's something that we should talk about later on, but did you know anything about that, Jim?
I do not know anything about that now.
Okay. Does anybody have any questions for Jim?
Jim, how many people in Littleton are being vaccinated?
So according to, and again, another interesting on the chart, according to the chart, they're using numbers. There's an estimated town number. But the total number of receiving their first dose was 4,955. So about 51% of the residents in Littleton have gotten a first dose. Interestingly enough, they don't have the total for the second doses, but you can do the math. It's about half that again, kind of thing. So.
Thank you so much. I really feel much better now. The question is, what happened to younger people? I hope they're going to get vaccinated because they're going to school, they're going to play, they're going to get, we don't want them to get sick.
No, I mean, so this week, Gino, would be the first week that people down to age 16 can get vaccinated. So now it's opened up to everybody that the vaccine's available to. And the Pfizer vaccine will allow you to get vaccinated down to 16, so.
Thank you so much.
Yep.
You're doing a good job.
I was talking to my son, Ethan. He's in school out in UMass, and he got vaccinated today. And he registered like 3 days ago.
Yeah.
It's like, how were you able to get a shot so quickly? And I think they're just targeting UMass to get students vaccinated, so they're all safer out there.
Well, the western part of the state early on seemed to have higher numbers for vaccination, so it may be that they have the ability, have the vaccine. I'm not sure if the school, was it being done through the school or through one of the local clinics?
He had to go into Northampton.
Okay. There's a series of clinics out there, so I think as a county, they're some of the higher numbers, yeah.
I think they are doing it on campus also, but maybe he didn't do it through school. I'm not sure.
Evan, you had your hand raised. You were waving.
Yeah, I was just wondering how the whole J&J situation affects the homebound vaccination program for you, Jim.
So
Is it on hold?
unfortunately, the day they put the pause on it, the day before we finished up the J&J that they had given us. So we had administered 100 doses of J&J throughout the district. And I think in talking with Tamara, our public health nurse, there may be another 15 people that we've determined are eligible for that. So it's not holding up a lot of people.
Okay.
So if on Friday they indicate that we can do that again, we'll reach out to the state and ask for some additional J&J to finish that up.
Got it. I mean, they're probably just going to say like, yeah, it's fine, just go ahead, right?
Well, I mean, Mike Harvey probably speak to this better, but I suspect they'll come out and put some kind of additional, warnings or advisories or whatnot on it. And I don't know.
They will have to put a warning label on it. And the difficulty is that I haven't seen the latest raft of data that they're using on which to base the wording and therefore how severe the restriction is, or how they word the label. They may have certain criteria. They may put an age one in. I doubt it. I think they're going to be looking for something else. I have no idea what they're not discussing widely what clinical data they're using to guide the decision about the warning label. And that's what you do routinely for anything, which are most frankly drugs and other stuff. They all have some kind of warning associated with it. This one probably they're going to be very, very careful and measured on what they do, because they do want people to take the Johnson & Johnson,
Right,
for obvious reasons. But on the other hand, they don't need more advertisements about the very, 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 very rare cases.
Yeah.
And if I were one of the very, very, very rare cases, I'd feel the same way. But it's a tough needle to thread.
Yeah.
But it's coming. If not Friday, then Monday.
Like, do you think they'll gotten the blood clots, and anybody older may not be so susceptible? So will it be reserved for seniors or anything like that?
I can't predict what they're going to come out with, because again, I don't know what data set they're using, how many more cases they found, whether or not they found any underlying signals that they could use. It's a 10-step process, and I have no idea where they are with them. And I don't think, other than the 15 or 20 people involved in this directly, have an idea either, which is the way it should be.
All right, any more questions or comments for Jim? Okay, all right. Is Kevin Davis on by any chance?
I have a Samsung up here. I can.
that's Gino.
Gino's listed already.
Is your phone on too? Or just your iPad?
I'm all set.
I don't see Kevin anywhere. I want to do this. We might get an echo if I click this one.
Kevin, can you text him and see if he can come? Thanks.
Whose TV is being used as a Wi-Fi relay system?
Well, we can, while we're waiting, we can approve the minutes if you guys are ready to do that. So Louise was missing from the April 7th meeting. So
You need a motion?
I need a motion, to approve the meeting minutes for April 7th.
Okay, I was present, so I approve the meeting of April 7th.
And I need a second.
Lisa, I think I was there for April 7th, but I missed last week.
It said April 7th, member
Oh.
act.
Okay, whatever.
It was just a COVID, that was a COVID. No, I think you were here last week. Yeah, because all the votes for those minutes that day, you weren't.
Okay. I'm sorry, I didn't review the minutes. I'm sorry.
That's okay. So can I get a second to approval the April 7th minutes?
Yep, I'll second.
Great, and we'll do a roll call. Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni,
Uniform, yes.
Mike Zeldin,
Mike Zeldin, yes.
and Lisa Flanagan, yes. Great. And the April 14th minutes.
I make a motion to accept April 14, was no problem.
I just wanted to change one thing. It was in the public comments that it says Kevin Davis stated that Mass Notify was activated. It was actually Dave from LCTV that told me, and then we told Kevin. So I'm just going to put that in the record so that we can change that. So thank you, Dave. So Dave from LCTV told me, and then Kevin texted Kevin Davis to join the meeting with the info, and Kevin said that he'd return at the next meeting to this. So that was the only change that I wanted to make.
Okay, no problem. I make a motion to accept it.
Second.
Great. And roll call, Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni,
Verona, yes.
Mike Zeldin,
Mike Zeldin, yes.
Lisa Flanagan. Louise, do you want to vote on it, or you haven't had a chance to read?
I'll just abstain.
Okay. And then Lisa Flanagan, yes. So with those changes, we'll approve the minutes for the 14th. All right. Any word?
No.
Okay.
It's vacation week.
Yeah. Correspondence. I didn't get anything this week. Did anybody else get anything?
No.
All right. Do you think this is a good time to, should we read your request, Mike? Or
It's my understanding it's been circulated to the members.
Yep.
Did you present last night or Monday night?
No, they didn't have a meeting last night. It was a holiday. It was candidates night last night, and Monday was a holiday. So we are going to present, Mike is going to present on Monday. I'll be there for moral support. If anybody else wants to be there at the select board meeting on Monday, that would be great. Anybody free?
Yeah, I think you want somebody to be there in person, or it's going to be on Zoom?
It's all Zoom, Gino. So you can just log in if you want to.
Well, then it would have to be a,
Oh, that's right, a joint meeting.
Yeah.
All right, so maybe Mike and I will just be there on Monday.
Oh, okay.
Okay. All right. And so any member comments?
I think we should go through the whole thing and discuss it, because we really have only discussed it once.
You're correct.
I'll be happy to read it to you if that's what you want. Or do you want to have questions put to me and I'll try to answer them, or both?
Can I ask Jim a question?
Sure.
I'm sorry, Jim. Is it possible for us to still continue with the nursing side?
You're muted.
So the bylaws of the agency talk about services offered to members, and that members can't kind of have one service or the other. So it's kind of an all or nothing.
But I remember going on your website and seeing some towns that do not have your service, sanitation, but they do have nursing. But the list for nursing is a lot longer.
So Neshoba Nursing Service and Hospice, which is a separate VNA, does serve towns that aren't member towns of the district, but the public health nurses fall under the bylaws, and so those communities. So the public health nurses that serve your town, those are for towns that are members of the agency.
Maybe it's help. Maybe I can help here. There's a distinction here that makes a big difference. Jim quite correctly recognizes the fact that there are public health nurses, period. They're a different category. They're generally well-trained in certain areas that, quote, nurses without the designation may or may not have. So they're a separate group entirely. And those are the ones, the public health nurses, that are the ones we're focusing on.
So think of Neshoba Nursing and Hospice Service as a separate VNA, Visiting Nurses Association, and that's a separate entity.
Because we never talked about nursing at that meeting.
I should also point out to you that we are an extension, or let's put it this way, a Board of Health in Massachusetts is by definition an extension of the state's Department of Public Health. Okay? And there are requirements, and the requirements include nursing staff. So anything that we do has to fulfill certain requirements. So it's not a point of discussion. It's sort of like it is what it is because the regulations require it.
I just didn't understand it that, I understood it that we would still have the nursing through Neshoba, and
That's what I thought too.
Nope.
But aren't they two separate contracts?
Nope.
They're billed separately.
they're billed separately, yeah.
They do. There are separate line items for what reason I don't know. It's one of those things that's always been.
So you're thinking the other Neshoba nursing might be applicable to us?
No, they're private. So that you get a doctor's orders, the visiting nurses come out and take care of you. So it doesn't provide public health service. It's providing essentially medical service for people at home, like a regular VNA.
Got it.
Okay.
Yeah.
I did not understand that at all, obviously.
So would you, Madam Chair, what would you like at this point?
Do you want, would you like to, could you read it?
Sure.
Yeah.
These are the requests of the Littleton Board of Health. First, 1, a request is made to place before the town meeting an authorization to withdraw from the Neshoba Association of Board of Health, NABH, in a planned and stepwise transition. 2, a request is made for the staffing of a director of public health, a sanitarian, nursing services, and an administrator to support the DPH, the Director of Public Health, and the Littleton Board of Health. 3, a request is made for the assistance from the town administrator, finance department, human resources department, and legal department to implement, including budget adjustments as necessary, to capture and integrate approximately $119,000 from the current NABH assessment fee, about $39,000, and payments currently made to NABH, averages estimated, with an emphasis on estimated, of $80,000 annually, $5,000 annually for public health emergency information response, and to supplement, if necessary, those fees and payments and include funds for information response. There then follows supporting information. Littleton, along with 8 other nearby towns, has been adhering to MGLC 1111, S26-3, and MGLC 1111, S31 by deploying the Neshoba Associated Boards of Health to provide public health services led by Mr. Jim Gareffi, Director of NABH and NABH nurses. There are 2 kinds of services, the very visible for fee-for services and the crucial and less visible non-fee services. Both are required under local, state, and federal regulation concerning public health and environmental protection. The current assessment fee from NABH consists of $26,573 under the classification of environmental, plus $12,126 classified as nursing. The fees for service come mainly from 3 service types under the category sewage construction, quote. One of the ones is application and plan review. The second is lot or soil testing. A third is sewage disposal construction work permits. These fees for service are driven by home building renovation, new construction, and septic system replacements. The time spent providing guidance, preparing plans, reviewing plans, pre-work site inspections, final inspections for permit, etc., and a butter consultation varies. The number of requests depends on the pace of renovation / new construction / replacement. NABH does not keep town-specific records, and Littleton does not maintain logs and records of requests. The fees have been estimated above by carrying out a date of extraction of the work notes of a health officer serving Littleton. That happens to be Jim. There are no specific time records.
Can we stop there?
Sure.
Sorry to interrupt you. But what do you mean, Jim, what does that mean you don't keep town-specific records?
When the fees come in, we down to sign it into a town.
Okay. So there's no way to track how many fees you get from Littleton?
Correct. Right.
Okay.
And by the way, that's as it should be. There's nothing that requires.
No, I'm just asking. I'm just asking.
I mean, this was very frankly, Jim was not very frankly consistent with how we worked together. Jim and the board, he was more than he basically gave a tutorial on how to run the association. So these are, this is what it is. Let's see okay. While the quality and trustworthiness of the work are of the highest standards and highly respected, there are reports of delays. This is not unexpected given the ongoing increase in population and in amenities in Littleton. Construction, renovations, and home improvements are projected to continue, and the number of requests and the time required to satisfy them track with those increases. Residents and other stakeholders expect the standards to be met and the quality of work to be maintained without delays regarding sewage construction. These require a full-time attention of a DPH to direct collection of site data by a sanitarian and to provide sound analyses and assessments. Site inspections of restaurants and other public venues that must conform to public health practices and procedures also require full-time attention. There are more than 70 non-fee clinical categories critical for public health carried out by nurses. Here is just a few of them that are, as far as I could make out, are ongoing in town. Immunization programs. By the way, I'm not talking about COVID, just immunization programs. At-home clinical monitoring, infectious disease surveillance, mental health / behavioral services, emergency elder services. Even without the COVID pandemic, the clinical aspect of public health demands constant daily attention. And during the COVID pandemic, the nursing staff has been carrying out not only the ongoing clinical services, like those plus others above, but also the challenging ones associated with the COVID disease. This is revealing the limits of a part-time approach. The nursing crew has been stretched to the limit in addressing the needs of multiple towns. Littleton needs its own public health department. Timely communications. NABH does not rapidly or are required to disseminate in Littleton to Littleton residents critical emergency information to the public vetted by the CDC and or the Commonwealth. The elected Littleton Board of Health has no resources to act in a rapid manner as is required in declared local, state, or national emergencies. This has led to delayed responses by Littleton residents and the spread of misinformation. The requested funds will be used to establish a Littleton Public Health Information Resource Center capable of preparing vetted announcements and guidance for rapid communication to the Littleton community, as do other towns. Organization and timing. The Director of Public Health will report to the Board of Health. The Board of Health will provide policy and priority guidance to the Director. The nursing staff will be coordinating their activities with the DPH and with DPH direction. A sanitarian will report to the Director of Public Health. The assignment to the Littleton Board of Health of an administrator assistant with requisite skills to support the DPH, including dissemination of public health information. The Littleton Board of Health administrator should be within the, quote, buildings and land use, close quote, offices to assure efficient and updated sharing of site information with other relevant town departments, including intake and resolution of public health service applications. The search and hiring process for the DPH should be concluded by a December-February period to give sufficient time for the DPH designate to complete the transition from NABH. NABH is permitted by their bylaws to offer only a full package of services, environmental, nursing, and thus none of these services will be available upon Littleton's withdrawal from the NABH.
Okay. Thank you, Mike. Does anybody have any questions for Mike?
Yeah, I have several questions.
Okay.
So number one is up in number 3, you talk about approximately $119,000. That is what we are paying NABH. And I think that's the money that you want to use, or that we are thinking will pay for a new director of public health. But you're also talking about hiring a sanitation, a nursing staff, and an administrator.
Administrative assistant, yeah, it's fine.
Administrative.
Sure. But yes, it's
That's a lot more money. That's 4, 5, 6 people with benefits that you're looking to pay.
I'd just like to point out to you that in addition, the town will be able to see on average, maybe it's too low or too high, no one knows for sure, somewhere in the vicinity of around $80,000 annually for fee for services. As noted
Okay, that's maybe one salary.
And if you'll also notice in the request, the implementation requires adjustments and also, if necessary, to increase the amount of money available for public health in the town. So to expect the town to be able to supply services of the type we're describing and compare it to basically a very first-rate insurance operation, it's not going to happen. The town's going to have to find, as necessary, additional funds to cover all the necessary staff to make the transition. So
I'm just questioning where the money's coming from, because
from taxes.
It's going to cost more than what we're paying now.
Yes, but I'd like to point out to you at the moment, we're part of a pool. And that's one of the attractiveness when the town basically could, as it were, meet its public health responsibilities as part of the association. That apparently is, although I can't honestly say it's happening right this moment, it's very close to happening where we don't have the coverage that a town of this sort going through the development that we're going through, given where we are historically, the insurance system, and there's been a lot of discussion with Jim about how far NABH can go. They can't hire specific people just to take care of Littleton. It has to be shared, and as far as I know, that can't happen. So I just like to point out as it were, we're going to be self-insured. That's the simply way to put it. We're not sharing the burden with any other town. We're on our own.
I'd just like to point out that, yes, the fees will come from taxes, but at the same time, I feel like there are a lot of pass-through fees that the town does not see right now because they go directly to Neshoba.
Yeah, but how much?
To the tune of like probably, I don't know, Jim, you could probably point this out, but $200,000, $250,000 a year.
No, I don't think so. I think that 80,000 that Mike's describing is probably closer. If it was 90, wouldn't be surprised, because the bulk of the fees are food service and septic system related work.
And are we charging for Title V inspectors? Are we charging for all those other fees? I mean, I feel like you don't do yourself justice sometimes.
We're not. Some towns do charge a fee for the Title V inspection reports. We did, Littleton doesn't at this point. So.
I just seems like a lot bigger scope than we originally were talking about at that one meeting. I was shocked when I read all this.
I'm not sure when you shocked. Okay.
Never shocked by Zeldin's writing.
Well, that too.
Never what? I'm sorry, I didn't hear that.
Never shocked by your writing, Michael.
There's a lot to get through.
Well, just to give you fair warning how you've been spared, is this started out to be a 7 to 8 page tome. Let me tell you,
Oh my God, Mike.
where I could have explained to you in detail precisely what we're looking at. Okay, so this is the shot, as it were. This is your vaccination, not the disease. All right. No, I don't mean to make light of this. I understand your concern, and one of the reasons that this came together the way it is that it's basically the reality of the situation. I mean,
Does it make sense to start a little smaller and then
Exactly. Yeah.
head on as we get additional revenues?
I'm not quite what you say. Start smaller, because we either have a public health
So we need
service
the nursing and
from the we stay in the association and hope everything works out, okay? Or we do what's suggested in the indicated in the request and have our own public health as every other, shall we say, town around us, with few exceptions. I mean, we are part of a group right now, but there is nothing that says that we should stay in it. And I think the reasons for not staying in it may or may not be, I think they're compelling enough. My big worry, this is my personal reflection, is that there's going to come a time sooner rather than later where we're going to have to do this. And I don't want us to be, as it were, caught out like a deer with the headlights.
Right.
All of a sudden we need, we have projects going on in town that need attention. And I'd just like to point out to you, there's a quality that Jim has established that's not going to go away. It can't go away. It's going to influence how we move forward. And what's happened is that as people come in with their permits, they're taken in the order in which they arrive with their application. So someone with a very large project is the same person, has the same status in line as someone who just simply wants to put wants to have a swimming pool and needs an explanation of why he can't put it on top of his leach field. Okay? So they're all in order. And if it takes Jim
I can answer that question if you want me to field that.
What'd you say?
I could answer that question if you want me to field that, if that'll take.
No, I wouldn't say, Kevin, unfortunately, you're not you don't have the credential. Neither do I. I just send all my questions to Jim, and he very graciously say, "Who in the sent you to me?" So I mean, he's very good about it. No, he doesn't do that at all.
Because I had it in my head that it would be like a gradual building of a department. Like we would start with a public health director, and we would still have the nursing with Neshoba. And as we got used to having a public director, then maybe we could have our own nursing and be our own entity.
That's
a lot. That's a lot at once.
Well, I don't think so. I mean, I want to put in proportion. The town is spending, I think Ed probably, if he's willing to correct me almost immediately, is spending somewhere in excess of $20 million to protect us from, or to lower our level of PFAS down to, what is it, 10 parts per trillion? So that's a lot of money spent on or the substance that at the moment the state has one set at 17. So I mean, we do
That
spend
doesn't
money.
have anything to do with this.
Well, it's a public health issue.
Well, I'm just talking about building a new department.
Well, there's
a way to do it.
Well, there are a couple of ways we can ease the transition, if that was your question.
Yes.
If we're so lucky and find, he or she to come in and take the role of the Department of Public Health director, that person could be on salary and we could still be a member of the group of the association to give that director a chance to basically understand what is involved in the position, what the terrain looks like, what the experience has been. This is not going to change anything for, if we go that way, it doesn't change anything for Jim. So you have to be clear, is it your concern that we'll have a full staff too quickly, or?
Yeah.
Well,
I know it's going to be a tough, any new thing is a tough transition.
Well, as I said, we have, fortunately, except for a few, because of time and other kinds of resources, we have standards already in place. Hate to put it all on Jim, but he's established certain bars that will be acceptable to us. Anything less than that won't work. Okay, it just won't work.
Big shoes to fill, Jim.
I'm sure that won't be a problem.
I think it's gonna be. Can't you tell I'm worried?
I've managed to talk. This is the reason Jim is special has nothing. He's a thorough professional. I shouldn't say this while he's online. He's a thorough professional. However, I did find out that the respect for him around other towns, near and far, for the way he approaches it is well known. And the feedback I got is anyone looking at this job is going to say, whoa, I better be good enough.
Yeah, I mean, that's an arrangement that you work out with whoever you hire, so that shouldn't be a problem.
So that part of it, which should concern us a lot, I mean, is one thing. On the money side, I think that you'd have to make the argument somehow that that the town shouldn't be in a position to, quote, spend that kind of money in order to get what would be a more appropriate in terms of resources and quality public health services. I mean, Acton has their own.
Acton is 30,000 people or whatever their population is.
And for all I know, they're underserved. I have no idea it's extremely difficult with a town like Acton, given what's going on, to find out really, as far as I know, there's been no slippage in Acton. They have their ups and downs, but you're right, it's 30,000 people.
Yeah, you can't compare us to Acton.
Yes, sure.
In what way I can't?
Just population-wise.
Okay. The staff level that Acton deals with is going to be very different than what we would deal with. So
okay.
The number of people involved are different. How assignments are given out is different.
Mike, I think you just need to ask for more money.
I didn't ask for, if you notice how it's worded, and I'm glad you brought this up. Okay. And if you'd like, I'll redo it again. It's a request on the part of the Board of Selectmen, the
Town administrator.
The town administrator, and most of all, the finance department to implement and to supplement funds as needed, as required. No one is presenting this as $10 out, $10 is all you got.
Right.
This is not presented that way.
Okay.
It can't be. That would be, I wouldn't even started down the path if that were the case.
Understood.
Can I just ask, Mike, what is your definition of a director of public health and or versus a sanitarian? Are they obviously different?
Oh, yeah.
Yeah.
Okay. From what I can understand, and a sanitarian is someone with sufficient training to take measurements, make recommendations based on those measurements. They may or may not have the complete package of engineering background necessary. This is all doing with what we'll call sewage-related construction.
Okay.
That's what a sanitarian does. it still requires shall we say, a more thoroughly trained and experienced person to provide the standards, the guidance, and frankly, carry out the sometimes very critical assessments, especially when you're dealing with some of the terrains and what's underground as well as above ground in some of these locations.
All the groundwater.
Well, that's among the other concerns. There's also the difference between a sanitarian sitting in a room with an engineer who also is working with an abutter, who's saying, no, you can't put a swale in there, or whatever they're coming out with, okay? Or I don't want one, or do please have one. The professional, quote, construction engineering skill required is above that level of a sanitarian. The sanitarian can, shall we say, reduce some of the running around that I suspect, I'm not sure, because I don't follow him every day, is there's a lot of running around that has to be done to cover a lot of these cases around town. So if we're going to go with the kind of building that's going forward in town, just take a look at what already has happened as well as what's planned.
Do you, going back to that, and maybe Jim can answer this too, is there a possibility that you could have in the whole department a full-time director and a part-time sanitarian? Is that even feasible to keep that department a little bit smaller? Is that possible, Jim?
I mean, it really will. I mean, anything's possible because you're creating your own department, but it's what your goals and what you're trying to achieve, and then what staff do you want to try to hire and have in place to be able to meet those goals. So you certainly could do that.
All right. And Ed, do you have anything that you can add to this?
Thanks, Madam Chair. Currently, the Land Use and Building Department is advertising and has received 19 applications for a business manager, administrative assistant, and that person would serve as the business manager for the building department, conservation, planning board, and the Board of Health. So I really appreciate all the hard work Mike's done. I like the road he's going down. I think it's the right direction for our town. It's just a big bite of a small apple, and I think that if we went with the DPH, and while I have Jim here, I beg you, please consider it, but I know he won't. But if we went with a DPH director and a part-time sanitarian, or but we are happy to and are willing to provide the support staff for the DPH director and any staff that needs to support him. So,
and there's something that I think Ed may have left out because of the time constraints and all the rest. But just remember that at the moment, what we're trying to do is have someone who represents Littleton at the table set by the state. Because in the end, Jim can correct me, the main thrust of any, shall we say, not just emergencies, but the rules and regulations flow directly from the state to us.
Generally speaking, boards have the ability to make their own regulations, but generally you're working with state regs.
Right, and there are restrictions on how far we can go, according to my read, at least one lawyer's read of the restriction on just. We got to be careful not to step on the state's rules while we're making our rules, and if you step on ours,
you can never go less than. But yes,
yeah. So my point is that we have to remember that whoever comes on board will also be. Have our seat at the table, as it were, set by the state, not just for public health, but also environmental protection, because those are the two agencies that regard us and treat us, and as far as they're concerned, regulate, quote, us as an extension of them. And they're very, I can assure you, they're very clear about that. I got to hand it to Jim. I mean, that he prepared me for this. So that's a very. I don't want to underestimate. And the other thing too is that I'm not trying to throw little candies out to people here, but we then become, with our own public health department, we then become, for better or for worse, I think it's better, in a position where we can apply for and even win our fair share as a town of tax dollars at the state level that should flow back to us for local health. And when they become available, and as they're available, those funds that are marked for by the federal government to flow to towns like ours, which, by the way, there are, and there'll probably be more. Then finally, and last, is that I don't believe, and I don't, if anybody here feels different, it's fine, that COVID is going to be the last we're going to see of a widespread infectious disease, maybe not pandemic size, but certainly more than 1 or 2 towns. I think it's going to occur sometime in the next 10 years. And I don't want to be out there looking for all the help we're going to need to do that.
Evan, did you want to say?
Just really quickly, what is the ability of the Board of Health to actually maintain its own budget and have its own coffers, so to speak?
Are you asking me?
Maybe Jim.
Not just familiar with how the municipal budgets work, so that's probably an Anthony question to see how that works within your town charter.
Got it.
My guess is, given normal town practice, the Director of Public Health will probably start out with a very small budget, and depending on what happens and what evolves, that will be her responsibility and how they go about it.
And Louise, go ahead, Louise.
I just want to backtrack a little bit, because in your write-up, you talk about delays, that there were delays experienced. Who was experiencing a delay? Where was that coming from?
Okay. The way I did the survey is I did it through a second party so that it would basically not have to, shall we say, come at it so that developers and builders, investors don't want to complain about a town regulatory system unless they can speak directly to whoever's in charge of that particular function. In other words, they'll talk to Jim and say, "Why in the blazes weren't you over here last week?" Or that's the problem. Okay. So what I found out was that these were anecdotes, and they stem from 2 sources. The 2 sources are, and by the way, some of the anecdote complaints were from people who build one house at a time every year or so. Okay. To people who want to move a shed and are disappointed they can't put the shed on top of whatever. So the answer is that it turns out what really affects it more than anything else is the time it takes to service each and every application and request that comes across the table. So they're not all 10-minute, they're not all 15-minute, and they're not half-hour. In fact, some of the most experienced developers, when you press them, will tell you, I didn't know, and these are folks who've been in the business for years, I didn't know that there was this underneath this rock shelf that I've got here. Had I known that, I would fill in the blanks. So that takes a while it's basically education, guidance, testing, and all those things take time, whether or not the request comes from someone with a big or a small project. And that's where I trace, frankly, 90% of the delays. And Jim may have a different feel about it, but that was because it was the time of the year, what else was going on at the town, in town at the time.
Okay, a project that gets delayed because of what is underground, whether there be ledge or whatever, it should not be blamed on Jim. I don't mean that, but I don't consider that a delay that Jim has control over.
Okay, whether Jim has control over or not, an investor or a person who has a loan to from a bank, drawing interest on it and wants to sell whatever he or she is putting up there, is looking at the 10 days. That's a lifetime. Okay. And I'm not putting this on Jim. Jim is doing
No.
his job.
Yeah.
So it's the fact that they're going to complain because he didn't get back to them 24 hours after they said, "What are you talking about?" I'm compressing what they say, obviously, but
Yeah.
the idea is that they don't have the answer that they either want, or the answer that they want to get doesn't come fast enough because it's not within 10 days or 24 hours, whatever their expectation was.
Okay, that's all going to still happen with our own public health director. All those problems are still going to happen. It's not going to solve a delay.
I guess, Louise, the only thing I would say is that if you had somebody who had more time, and that's the thing, and I've told Ed this when he talked to me back in the fall, and there's a certain number of hours in the day. Some of these building permit applications, I mean, there was one, somebody wanted to put a pool in, and the pool company didn't really do their research on where they wanted to put the pool. So the first go around, it was going to be dig up the septic system, put the pool there. So the second time was going to be probably put it on top of the well. So that took some time, and the time creates a delay. But I'd rather the delay than, complaints from the homeowner that we dug one or the other up.
Right. So, and builders are very familiar with delays, material delays, whatever. It's just part of the nature of the beast.
Familiarity breeds contempt.
Right.
Yeah. I'm just saying this is not going to solve the problem.
More time might, though. So if you had somebody and you throw more time at it, you could probably address some of those delays.
Jim, all I'm remembering is the start of COVID, you and me up at the point passing out flyers. And I asked you, how many towns do you go have a weekly meeting, COVID meeting with us with? And you said none, just Littleton. Every week you've been here having a meeting with us for the past more than a year.
And I've enjoyed the times with Katrina there because I learned a lot more than a public health call. So it's been useful.
Oh, that's good. I don't understand. I don't find a delay with you. I didn't when I was chair. So I just want you to know that.
Yeah. But I think, Louise, if we have our own person and our own department, then they're dedicated, Jim's.
Right.
Jim's
It's
dealing
time.
with how many towns? 8?
I work directly for 3.
Yeah. So no, there's no mistaking how dedicated he's been to us.
I know. That's what I mean.
For 4 years that I've been on the board. So no mistaking that.
He's at our beck and call.
He's like, yeah. He's very accessible. So, do you guys have any other questions for Mike? And I think we are still members of the Neshoba Board of Health until July 1st, correct?
So the way the general law is written, if you vote at annual town meeting to withdraw, the withdrawal becomes effective a year later.
Oh, okay.
So to your point, Mike, if that's what you need time-wise, it sounded like that's what your time frame included, having somebody at the beginning of the following spring to train and be ready to go.
I don't mean to interrupt, but I honestly don't know what the pace of this is going to be. Okay. It could be 2 years for all I know, before the town feels that the human resources and the finance department feels comfortable that they can do this, because there are other, shall we say, events going on in town in addition to this one. So I have no idea what the timeline would be, and I'm trying to, when I use the word transition, it meant transition. The idea of coming in in May of this year and saying, okay, we're out, that's foolishness. So that's not going to happen.
Yeah.
I can assure you it's not. And I think any responsible finance department or human resources, especially in this environment, will tell you they need the time just to get their act together. And I can only guess what the select board and others who watch the budget very carefully, what their views are going to be about how to bring this in.
Right. And Louise, this is just a request. This is not, we have to go through select board too. So it's just our request, and Mike's done all this research and
Oh, I appreciate all your research, Mike.
No, it is I want to make it clear, this is a request to do this.
Yeah.
I don't want to soft soap this. This is
Yeah.
what we're not doing is we're not trying to get, don't pay no attention to the mask
I was
mandate.
just gonna say, hi.
Yeah.
Was that your wife?
No, that I have a
Burglary
house
in your
full.
house.
I have a house full of teenage boys now.
Oh my God. I hope you're vaccinated, Mike.
That's I need more protection than that. It's food that I'm starving most of the time now. Anyway, okay. Let's be clear. This is it on a scale of, this is not the same thing as what we're really trying to do here is have something brought into place that matches the growth of the town. So if you look at what's on the deck, what's coming, whether you're talking about near the train station or the other pieces that look like they're falling into place, you're looking at increase in our population, which is already occurring and continues to occur, and the nature and state of the housing market.
Yeah, I know, it's crazy out there.
I mean, technically speaking, there's always one around somewhere. Okay. Technically speaking, this is preparation for a future that is probably within, shall we say, we are going to be heavily burdened in probably about 5 years from now. Really, it's going to hit us if we don't start doing something now.
Jim, have you gone through this before?
Have not.
I to be the first.
He is the ultimate professional, just
No, I know.
to be able to talk to you, Jim, and you answering honestly, it's great. Thank you.
Yeah. Oh my gosh.
Really understand what you're trying to do. So
We can ask any question and you don't laugh at us or
He laughs at me all the time, so it's all
Well,
right.
that's only now because you make me be on screen as opposed to.
Oh, I just don't like change. I really don't. I struggle with it.
Okay.
I can't think of another question right now. So
Kevin or Gino, do you guys have anything you want to ask Mike or Jim?
All set.
Okay. All right. Thank you, Mike.
And by the way, I have no difficulty, just so you know, no difficulty if you folks want to, pursue this further before next week. Answer your questions, because I know that you all can't show up and and roll in. That puts you at a distinct disadvantage. But I'd like to have the feeling, if I go in there, that that Louise and that all of you feel comfortable enough for the requests to be made, understanding what the requests are.
I mean, Mike, if you want a motion to approve the letter to be submitted on behalf of the Board of Health, I would make that.
is this what you're talking about submitting, what you sent us?
Yes.
I think so.
Yes.
Yeah, I don't think we can vote on anything. It's in member comments. It's not on the agenda, Kevin.
Can I go through it you want to submit this whole thing? It's kind of
Are you reading it or submitting it?
have it up on my other screen.
I think we've already submitted it to
You
Janet.
did?
Oh, Diane did too. Yeah, last week Kevin said fine, Gino said fine.
Oh, okay.
It looked good, and so I submitted it to Janet, who I think sent it to Joe Layton, and Anthony has it now too. So it's going to be on Board of Health's agenda, Select Board's agenda on Monday.
So the administrator position is a part-time position, correct, Ed?
I think it'll be full-time, but they'll be dealing with different departments.
I don't think we make that decision. I think if Ed can speak for himself, as far as I know, the administrator for Board of Health is going to be part of an operation that's in land use. And use.
He was just talking about hiring a business manager.
Well, the
Manager,
business manager, the business man, it's a slash title. It's business manager, administrative assistant. The issue that we're having in land use currently is that we all have our own small little budgets and islands, and we have to do our own payroll for our own staff and our own expense accounts and reimbursements and mileage and all that. And we're looking for an administrative assistant business manager we're going to put all of our budgets together as one. And we're going to have somebody manage so that I, as the building commissioner, zoning enforcement agent, can focus on plan review and zoning enforcement along with my assistant. And Maren, and hopefully she'll have an assistant at some time, can focus on town planning. And Amy Green and her future assistant can focus on conservation. And the director of public health, God willing, will get one, and his sanitarian and public health nurses, whether it's per diem to start off or part-time, however you folks working with select board and HR and finance find a path forward to fund those positions. It could certainly be done. I think Mike's right in proposing all of the positions. How they come into place is, maybe you start with the DPH director and a per diem sanitarian, a per diem nurse, public health nurse, and we have in land use a support staff to help get this off the ground. And as the town grows, I see all of these departments probably, even though we're going to be put together as one at some point, they'll probably have to fracture again and be standalone. When I did my presentation for the reorganization to the select board for this to put us together so we'd have support staff, if you notice, I don't know if you guys saw it or not, but I held off the facilities because I didn't want it under the roof where we regulate building code. We didn't also want to be in charge of fixing it. We need to be able to inspect it. But I did offer that we could provide in the beginning for that startup department to provide the support and have a support staff for them. So again, we'll grow, as the town grows, the departments grow, and eventually they need to stand on their own, and that's what will happen.
so does that mean the budget for the Board of Health is going to be under the land use budget?
That is up to finance and the Board of Health and and
Because I don't feel like that should happen.
No, that's not what's envisaged.
it's so everybody has their own budget,
Okay.
but who manages and payroll, and like I don't need to take my time to do payroll for everybody in land use or just even in my department. If we have somebody that's a business manager doing payroll for my budget and for the planning budget, the conservation budget, and the Board of Health budget, they're all the budgets still stand alone. It's just somebody else managing them.
Okay.
They still get reviewed by the department heads. But we don't have to. We can focus on what we get paid to do, which is be the building commissioner, be the town planner, be the conservation agent, and be the public health director.
We get paid?
No.
Okay.
Can we get a free dump sticker?
Yeah,
See, this is why I shouldn't be in land use ever.
Can we get something?
all right. Any questions, any more discussion?
Motion to adjourn.
No, we have to ask for public comments or member comments.
Oh, I just have one, just so that we're prepared for next time,
Mm-hmm.
if you don't mind. I just want to, I'm sure most of you have seen this, but it looks increasingly as if herd immunity probably will not occur in the United States for COVID. I'm sure most of you have seen that. The meaning to us, and Jim can weigh in, the meaning to us, it indicates that there's always going to be some amount of that disease around at any given time with the usual, shall we say, seasonal or aseasonal schedule. And the second thing is it's probably going to be a yearly availability every year for what we'll call, I'll call it a booster, or I'll call it a secondary vaccination, like we do for the flu.
Mhm.
So the notion of herd immunity occurring is, in summary, unlikely, and the implications of that is that part of the public health operation will be scheduling, operating in concert with the state and federal government that, shall we say, ongoing immunization and protection program.
When you speak of herd immunity, you're speaking of nationally. What you're talking about. I mean, Massachusetts will probably experience herd immunity, wouldn't you say?
Okay, there is no glass dome over Logan Airport. There is no glass dome over the train stations. There are no glass domes over our borders. As far as I can make out, there's only one, and it's over a very small piece of Texas where my granddaughter goes to college. Other than that, there are no domes. Okay, so the result is that I don't know if whether or not it's 70% or higher here in immunization. I don't think it matters that much. I think that it's not going to happen countrywide. So there's still people who will refuse to get vaccinated. If there are enough of them, it's going to create this problem.
Yeah, I was speaking with friends the other night. I said, I'm going to get my shot. And they said, well, I'm not going to get my shot. I said, what? What are you talking about? Why aren't you going to get vaccinated? I don't want to. It's crazy.
Is herd immunity 80% or 70%, Mike?
85.
Starts around, Jim knows, he knows the magic number.
I don't, because I keep hearing either 70 or 80%. I'm not sure if that's fitting the narrative that the person is speaking about. So I hate to be cynical about it, but you hear that difference. So.
Well, in my own experience, the only reason I'm mentioning is that up till about maybe 2 or 3 weeks ago, I heard the word herd and immunity used in the same sentences right next to each other from folks I talked to who are involved in this. And then this week they'll say, what? And then the message has come through. It's not, the numbers don't look like it's happening unless, I mean, I hope it does, but right now it doesn't look like we're going to hit 70 or we'll be lucky to hit 70. I doubt 80.
I mean, I don't understand how you can have it with all the variants that come in.
Right, that's what the boosters might be for too. Because, Mike educated me way back when. He said the vaccine is not going to cure it. It's just going to make if you do come in contact with it, your symptoms will be hopefully more minimal. So anyway, all right. No more member comments? And any public comments? Anybody with their hands raised? Ed?
No hands are raised.
All right. Next meeting next week, the 28th, 7 o'clock. That will be, we'll have a COVID update, but and did Kevin Davis ever get back to you?
He didn't. I think he's on vacation. I think he.
Okay. All right.
Madam Chair, if I may, just before you guys move to close.
Sure.
Just to let you know, on the 28th, the warrant closes, so Mike's proposal in front of the select board will need to be voted that night, or it won't make the warrant. Just FYI.
School board, the select board has to vote on it. Yeah. And I think that's what we're proposing for Monday.
Okay.
All right. So we'll meet next week, and it will be, if there's any public hearings, and then we'll have a COVID update too. And hopefully it's nice and low. So, all right. Motion to adjourn. Anybody want to make one?
Motion to adjourn.
I'll
Okay.
second it.
All right. We'll go by roll call. Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni.
He said yes.
I think he said yes. Louise Nichols,
Louise Nichols, yes.
Mike Zeldin,
Mike Selden, yes.
and Lisa Flanagan, yes. All right. Thank you, everybody.
Good night.
Night.
All right. Thanks,